Hello, and welcome to Talk Trillium, Partnering for Patients. I'm Patty Cochran, Senior Vice President and Chief Innovation Officer at Trillium Health Partners, which includes the Credit Valley Hospital, Mississauga Hospital, and the Queensway Health Centre. We know we live in a community that has been growing and changing over the past 2 decades. Our community's healthcare needs have been growing and changing too. At Trillium Health Partners, we know we need to plan for the future if we are going to improve access to the high-quality care our patients expect of us and to meet their needs now and into the future. It means we need to do things differently. We need a new kind of healthcare for a healthier community. We have a plan to get there that includes providing care for our patients in new and innovative ways and revitalizing and expanding our infrastructure so we are there for our patients when they need us most. We will also continue to work with our community partners to expand services and improve access to care beyond our hospital walls. We are building a complete network of care built around you, our patients. We'd like to share with you how we are planning to deliver on our promise of a new kind of healthcare. Recently, I sat down with our President and CEO, DiEmanuele, to discuss the growing needs of our community, the vision we have to meet that challenge, and how we're going to get there. Thanks for joining us, Michelle. You are the President and CEO of the Legacy Credit Valley Hospital, and you're approaching your 3rd anniversary as President and CEO of the newly merged Trillium Health Partners. So 3 years in, can you tell us a little bit more about how this merger is working?
Well, Patty, when we first went to the community to talk about bringing the hospitals together, and we talked to almost 30,000 people post-merger about what they really wanted to see happen in their new hospital. And it was, very clear. They didn't want to wait for services. They wanted to know that the services were close to home when they needed them. And they wanted to ensure that the quality was high in the services that they were getting. And I can tell you that we're making progress on all of those fronts. When I think about the expansion of programs that we've had with brachytherapy, needed cancer services that people used to travel, women would travel outside of our community to get. Well, they now are here in our community. When I think about the increased number of beds that we've been able to open by partnering with our various programs to create efficiencies to expand service, that's happened. I think of cardiology and our DART program in the emergency department so that you're no longer admitted waiting for testing, but you're getting that in real time and being able to do that as an outpatient. Again, just a much better way to deliver higher quality care. And I think about the attraction of new talent to our organization. Our hospital's been able to attract leading physicians internationally, and that has, of course, allowed us to both expand, but also allowed us to bring in new programs that we didn't have.
Lots of benefits I'm hearing from the merger then. And 3 years ago, we committed to our community a new kind of healthcare. And I know as a President and CEO, you're out there, you're talking to patients all the time. What do the patients tell you that they want to see in this new kind of healthcare?
Let me just say that the healthcare that got us here today has served us well. And we are benefiting from 50 years of history of building very, very high quality care. But we also know our community is growing and expanding, and with that comes the need to do things differently. But patients have been very clear about, as we do that, what is important, and that is that the system is easy to work within and to make their way to where they need to get to. Too often, they find it difficult to navigate, that they're unsure of where they should be, or as they make their way back home from being in a hospital, what that means in terms of the supports that they get. And so that simplicity and clarity around navigation was very key. Patients also don't want to wait. We don't want them to wait. And they also want to know the services are there available for them when they need them.
So you mentioned our community is growing, Michelle. What impact does the population growth have within our walls of our hospital?
Well, I think it's important to talk about our entire community first, and that is whether it's healthcare, social services, policing services, etc. All of our services have not been able to grow at the same rate that we have seen our population grow in the last 2 decades. And with that means we have pressure on those services. And it's unprecedented when it comes to healthcare. We are seeing a proliferation of growth in our seniors population as we all get older, some 150% growth as we look over the next decade, growth in our pediatric population. There's a mini baby boom going on here in our region. And so that has put absolute pressure on our system. And with that, means that we have to be looking to the future. A new kind of healthcare is about finding different ways to deal with that. We've had over $700 million worth of investment in our hospital over the last 5 or 6 years. And that's been needed investment. New beds, new wings, new programs. But it still isn't enough. Today, we have over 70 patients waiting for a bed in the emergency department. These are patients who have been admitted, but there's no bed for them right now. We need to find ways to deal with this. It's important that they're in the hospital, that they're getting the care that they need, but that isn't the right care at the right place and at the right time, and a new kind of healthcare commits to that.
So building capacity within our walls, what are some of the things that we might see into the short-term future as we're building that capacity to address those patients waiting for admission to hospital?
So I think there's a three-pronged strategy. First, we always have to be looking at how to use our existing resources, our existing beds, our existing human resources more efficiently and more effectively. And we strive to do that each and every day. So for instance, if we take programs that may be at 2 different sites and put them together, it does 2 things. A, it allows us actually to improve quality. The more you do something, the better you get at it. The second thing it does is it also can help us do things in a much more effective way in terms of the flow of patients through our hospital. And that frees up more capacity to not keep people waiting. So that's one of our strategies. The second area is partnership, looking at how we can work with other partners. We've developed a partnership with Runnymede, an important rehab facility in our area, and that has allowed us to have 33 patients get the needed care that they need faster. So partnerships are important. Partnerships with our CCAC in transitions to home. The third part of the strategy is we need more beds. Today, as I've said, we have patients waiting for a bed in our hospital. In 3 years from now, we'll be some 300 beds short. That means that we need to build more beds too. We can do these other things to ensure we're using our resources effectively. However, we still do not have the infrastructure in healthcare that we need in this community. You're going to hear us talk about that a lot more in the coming weeks ahead.
So are we as efficient as we could be? Is our hospital running as efficiently and effectively, do you think, as other hospitals are in the province?
So let me just say, I think everybody tries very hard to deliver the best care they can in this province. What I can tell you in our LHIN, with our sister hospital, Halton Healthcare, we are running 2 of the best performing hospitals in this province. Together, we would return over $750 million of a dividend to the province if everybody operated as efficiently as we do. We know that people in our hospitals are able to get home faster because of the services that we provide them. They don't wait as long. Our 2 emergency departments have shown a 25% increase in the reduction of wait times over the last year. And so I could go through so many different metrics, but at the end of the day, it doesn't actually mean anything if we still have patients waiting. And patients waiting is what we focus on, and efficiency is one of the tools by which we can reduce that wait time.
So as we strive to build a new kind of healthcare for a healthier community, we are, as I understand it, we're faced with growth, not only in our population, but also aging and a baby boom situation. We're efficient in what we do, but we still are faced with unprecedented demand and a need to build capacity both in the short term, the medium term, and the longer term. And I'm very excited to hear about all the partnerships we're doing within our community to build that capacity. But I also heard you mention that there may be some short-term changes in where we site our programs as we take advantage of what the mergers created. So I guess those changes will happen in the shorter term. Can you tell us how long does it take to actually create a master plan, or how many beds do you think we'll need in the future?
So let me just say that we will absolutely always look at how best to use what we have today and ensure that our patients have access to what they need. But in the longer term, as we look at a master plan, we have to do it faster than anybody's ever done it before. And I have confidence we can do that. We need 955 new beds in this community over the next 10 to 15 years. And typically it takes about 10 to 15 years to build the average size hospital of about 300 to 400 beds. We need to start now. And we've submitted that master plan for 955 new beds in this community a year ago, almost, to the ministry. And we're working to get the next stage approved. We work cooperatively with the ministry and the Government of Ontario, and I'm confident that they understand the need in this community. But they too have challenges, and we understand that. But collectively, we are looking for ways to advance this faster, and I think the next logical step would be to see our hospital receive funding to advance that planning and to particularly open up an urgent care center in North Mississauga and develop a health hub that would help to advance our master plan, of which that is a part of.
So building 955 beds, that's almost double the existing beds we have in our community today. And it takes almost a decade, I guess, to build those beds. So you're busy and working both in the short term, the medium term, and the long term. And that's really great, comforting to know from our community. Anything else you want to add, Michelle, about some of the challenges?
I would just, I think, end by saying that we're blessed in this community to, in fact, have such an engaged group of leaders, whether it's policing, social services, local council, an engaged patient population and family population that care about their healthcare system, even when they're not using it. And I think this collective spirit is what has got us this far. And so our commitment as the hospital is to continue to engage, to empower and to work alongside and with our community to make sure that their issues, their needs, and the pressures that we're experiencing are understood, and that solutions are constantly put in place to address them.
Thank you so much for joining me today, Michelle.
Thank you, Patty.
Welcome back to Talk Trillium, Partnering for Patients. The front door to healthcare for many in our community is the emergency department. And our emergency department at Trillium Health Partners is one of the busiest in Canada. As our community is growing and aging, the need for emergency services is rising by 5 to 10% every year. Our capacity challenges are very real. Our emergency departments are operating at 50% over capacity, and each day our hospital has patients waiting for a bed. We know we need to act now to ensure we can meet the needs of our community now and in the future. I recently met with our Chief of Emergency Care, Dr. Letovsky, to learn more about our capacity challenges and how we can work together as a community to ensure emergency care is available to our patients when they need it the most. We're here in the heart of the emergency department at the Mississauga Hospital, and joining me is our Chief of the Emergency Program, Dr. Letovsky. Dr. Letovsky, every day patients are waiting for a bed in the emergency department. Can you tell us and explain to us why that happens?
Well, Patty, our emergency departments are really not only the front door of the whole hospital, but really for many patients, the front door into the whole healthcare system. The population's growing and the population's aging. Patients with chronic disease get acutely ill from time to time, requiring the services of an acute care hospital. They decompensate, they go into heart failure, they get pneumonia, they get strokes, and they have to be taken care of in our emergency departments and then admitted to the hospital. The problem is we don't have enough capacity in our hospital to care for the population that requires the urgent services that a general hospital can provide. There are more patients requiring admission than we have capacity to house them in the hospital. So if there aren't enough beds in the hospital to take care of admitted patients, patients wait in the emergency department, sometimes a day, sometimes 2 days, until a bed becomes available on the wards. It's a matter of supply and demand. We simply have too much demand for the capacity that we can provide.
In some ways, it's kind of like an assembly line if we think about it, so that if we have too many patients in our beds in the back end of the hospital and they're not leaving the hospital at the same rate as you need to admit patients into the hospital, it creates a bit of a backlog.
Well, that's correct, Patty. You have to remember that there's really only one hospital serving the entire Mississauga city. Many cities that have a population of 600,000 or 700,000 may have 4 to 5 hospitals. We have essentially one hospital serving the entire city of Mississauga. We certainly do not have enough capacity to deal with the population.
Thankfully, we've got plans to expand our capacity within the emergency department. What kind of changes can we expect, and what will that mean for our patients?
Well, in order to provide the best possible care to patients requiring emergency care and urgent care, we need not only the best doctors, the best nurses, but we also need the best facilities, Patty, because I can assure you that if we can provide the best possible space, we can provide more efficient care and higher quality care as well. We can provide spaces that are designed to improve care for our most vulnerable patients, the elderly, our children, and patients with mental health. So the design, the space that we have is critically important to improve the care that we can provide to our patients.
And what about our community? What can people living in our community do to help ease some of the burden and the pressure in Emerge? Because if we can help ease that burden, we can make sure that the community's got access for emergency care when they're very ill.
Sure. Well, the first point we want to make that certainly if you think you need to go to emergency department, you go. We're there to treat all patients 24/7, absolutely. And patients should never hesitate about coming to an emergency department if they think they have a serious acute problem. But in the interim, there's lots of things that people can do. Get your flu shot. Simple thing to do. Flu shots work. So to
where
avoid
do people
getting
get flu shots?
Anyway, your family doctor. You can go to Shoppers Drug Mart. You can go to any pharmacy now to get your flu shot. It works. Make sure to get yourself a family physician. There's a lot of people who don't have family physicians in the community. So obviously, if you don't have a family physician, you're going to tend to go to a place that's more convenient. So get yourself a family physician. Make sure you have regular appointments to stay healthy.
That sounds like a few basic rules that we need to do in order to help keep our emergency rooms open and available for when we need it.
Correct.
I just want to say thank you for joining us today at Trillium Health Partners.
Nice to be here.
We see more than 260,000 visits in our emergency department each year. While we are making the most of our physical space now as one of the most efficient hospitals in the province, the reality is that our community has outgrown our hospital's physical capacity. Despite these challenges, our highly skilled and dedicated nurses, physicians, and staff are committed to delivering the highest quality of care each day. I visited the emergency department at our Credit Valley Hospital site to hear firsthand how our passionate staff are working hard to meet the needs of our community. Let's take a look at my conversation with emergency nurse Melissa Merson. Thanks for joining us today, Melissa. You've been an emergency room nurse at Trillium Health Partners for 3.5 years. Have you always wanted to be an emergency nurse?
Actually, from the age of 4, when I was in the kitchen and my mom turned her back for that split second, as all mothers do, and I went ahead and I grabbed the knife and I tried to cut the orange myself, and knife went straight through my hand. So she drove me over to M-Site there. And we were in the emergency department. I was waiting to get my stitches, and I just remember being there and watching all the hustle and bustle and the smiling faces, and I just knew right then and there I wanted to be a nurse, and especially an emergency room nurse.
I think hustle and bustle is a great way to describe an emergency department. There are challenges, though, with all that hustle and bustle. Can you describe some of those challenges working in the emergency department?
Yes, definitely capacity. We see over 300 patients at Credit Valley every single day, and some of those patients get admitted to our hospital. Unfortunately, we have anywhere between 30 to 60 no-bed admits here in the emergency department. Those are patients that are waiting for beds up on the units here at our hospital. This is unfortunate because it decreases flow for our emergency room patients and also decreases quality of care for our patients that are waiting.
We continuously seek to improve the situation, and so can you describe some of those improvements you've made for flow and how to compensate for that?
Yes, some of the things that we've been doing is we created cycling areas in our emergency department where patients will come into an area and sit down in a waiting room, and a nurse will see them right away. We'll initiate medical directives so that we can get their blood work, ECGs, all of that testing done before a doctor even sees them, so that's ready to go. Right. Then a doctor will see them in the assessment room, go back to the waiting room, and once the diagnostic imaging is back, we can go from there.
Now, if you had more space, what would that feel like?
That would be amazing. Currently, Credit Valley Hospital was built to see about 50,000 patients a year, and we're seeing over 100,000 patients now. So to have that space would be very beneficial. Fortunately, we're going to, this year, start renovations to increase the area here in our emergency room. And some of the areas we're going to be having is a pediatric area as well as mental health. These are populations that need specific care, and it would be amazing to be able to provide that for them.
And if we were able to create an urgent care center, much like we have at our Queensway Health Center, would that be helpful for this community?
Yes, with the number of patients that we see here, to be able to decrease those numbers and to have another area for patients to be able to go to get care would be amazing.
Thanks for joining us today, Melissa, and a big thank you to you and all of the exceptional staff and physicians who work 24/7 around the clock each and every day in this emergency department. Thank you.
Thank you.
At no time is the need for partnership and collaboration more important than when our patients are transitioning out of the hospital and back to their homes. Their healthcare journey doesn't end there, and our work can't stop there either. I spoke with nurse Germaine Subnaik about how partnerships and seamless transitions from hospital to home are an important part of our work to ensure our patients receive the best quality care where and when they need it the most. And this is very often in their own homes. Welcome, Germaine. You're a nurse, but you're also a navigator, a patient navigator. Can you explain what the role is of a patient navigator?
As a patient navigator, we help we assess their patient's needs on admission, and we formulate a plan in terms of transitioning home when they're medically stable.
And who's on that team as you prepare for patients to go home after hospitalization?
As a part of the team, myself, a patient navigator, and our all of our allied, our PT, OT, and all of our allied people, and also our community care coordinator from Mississauga Halton CCAC. We work together in formulating an action plan to transition our patients home.
Along with the patient's physician, I assume?
Absolutely, with our patient's physician and the whole team, the care team.
So PT/OT, you mean physiotherapist and occupational therapist?
Yes.
So what are some of the challenges that patients and families face as they go from hospital to back to their home?
As our patients come into hospital when they're very, very sick, we find that they're very overwhelmed and they're not prepared to, they're in crisis, they're not well. So we try to prepare them by engaging our community care partners and bringing them earlier on from admission to work with our patients in terms of putting them in touch with the community resources. So Mississauga Halton CCAC care coordinators, we bring them in to try to provide information at what services are available to help with the transition earlier on, to give them the knowledge that they need, to give them the confidence to leave the hospital when they're medically stable to be ready to be discharged, to transition them into their homes.
Now, I understand we've heard from our patients that transitions out of hospital don't always go smoothly. And we're testing a new model called Seamless Transitions. And you're part of that model. How is that going?
It's going very well, I must say. As part of a member of the design team, made up of all frontline staff, so we recognize that patients are going home and their needs are higher because of their multiple health problems. So we engage with our community care partners and external service providers, the Mississauga Halton community coordinators. We work together and collaborate in terms of getting them home, transitioning, and providing providing their care needs when they need it, and giving them the information they need to transition them home.
And I understand we're inviting patients to tell us about their journey so we can learn from what went well and what didn't go so well in that journey going home. So thank you very much for joining us today, Germaine, and sharing with us some of the work that we're doing to improve transitions for patients from hospital to the community.
I think one of the things that help on seamless transitions by engaging our community care partners, our family physicians, our family physicians and the community care coordinators coming in to help transition them easier, and we follow them throughout 2 weeks into the community to ensure that their care needs are being met, so that it would divert them from coming back in, to make sure that all their care needs are being met when they go home.
Thank you for joining us.
Thank you.
Welcome back to Talk Trillium, Partnering for Patients. We are working hard to reimagine the way we deliver care to all of our patients. We are looking at ways to treat patients faster, more efficiently, with better outcomes, so they can stay healthier longer at every age. One of the programs where we've seen innovative ideas used to enhance care for our patients is our cardiac program. I recently spoke with Chief of Cardiac Health, Dr. Manish Maingi. We're here in the Cardiac Catheterization Lab, an integral part of the cardiac program at Trillium Health Partners. And joining me today is Dr. Manish Maingi. He's the Chief and Program Director for the cardiac program. So welcome, Manish.
Thanks, Patty.
Delivering the highest quality of care for our cardiac patients has been so important for our organization, but we do have some challenges. Can you tell us a little bit more about what are the challenges that you face in the program?
Well, currently our cardiac program is perfectly sized to deal with our current population of almost 1 million people. But our real challenge is how are we going to expand and innovate to deal with the expanding demographics, that more people and older people that will demand more cardiac services. We estimate about 40 to 60% more demand for cardiac procedures and inpatient beds in the next 10 to 20 years. So our challenge is how are we going to adapt to the pressures that our local demographics are going to give us.
In the face of some of these daunting challenges, we're often faced to look at new ways of delivering services and to innovate programs a little bit. Can you tell us about a couple of recent examples where you've implemented changes?
One example is our DART program. DART stands for Direct Access Response Team. And the basic idea is to get patients in the ER in front of a cardiologist quicker. So the DART program allows a cardiologist and a specially trained nurse, a nurse practitioner, to very quickly assess patients in the ER that present with cardiac symptoms such as chest pain and shortness of breath. And we've been able to demonstrate that that time interval, that gap between arriving to the ER and seeing a specialist, has dropped by between 50 and 70%.
Wow, so for a patient that means they have to wait less time in the emergency department, but I also understand they're admitted to hospital less often and are given follow-up care more quickly.
Yes, it's all about right care, right time, right place.
That's perfect. What is the future vision for the cardiac program?
Well, one of the things that we need to do is do more of everything and do it better. So to do more of everything, we need more capacity, more operating rooms, more catheterization labs, more beds. The other part is doing things better, and that's about harnessing technology and using it effectively and safely. And one of the examples of that is the TAVI program. That's a program whereby we're replacing valves in the heart without opening the chest through minimally invasive techniques. And I see in the future more minimally invasive procedures allowing patients to recover quicker and stay in hospital.
And what about chronic disease?
Well, chronic disease is something that is expanding and challenging not just the cardiac health program, but all programs. So we need to partner with patients better to keep them out of hospital, keep them healthy. And we're doing that by expanding our outpatient clinics and ambulatory care programs. And I think with partnering for patients and giving them more accountability for their own care and helping them through that, we can keep patients healthy and out of hospital.
Thank you for joining us today.
Thanks, Patty.
We know that patient-centered care is vitally important to improving access to care for our community members. We envision a system where people in our community know how and where to get the care they need. A system where care for all patients is coordinated around them for the most effective treatment. Working together with teams of healthcare providers to provide seamless care inside and outside the hospital, we can enable coordination amongst providers and design services that are easy to navigate and truly respond to the needs of our patients. I'm here with Dr. Craig McFadyen. He's the Regional Vice President of the Cancer Program and the Chief of Oncology at Trillium Health Partners. Welcome, Craig.
Thank you, Patty.
Maybe one of my first questions is, you often treat patients with cancer. I understand it's quite a complex journey. Can you describe that journey for us?
It is very complex, and it unfortunately comes at a time where people have the most stress than perhaps they've ever had. In an attempt to provide higher quality care, we get increasingly specialized in our work. So a cancer patient may move from their family practitioner to a surgeon, through several diagnostic and staging tests, to a medical oncologist, to a radiation oncologist, to a pain and symptom management specialist, or to an allied health or nursing specialist to look after specific symptoms. So as we try to get more and more specialized, there's more and more people who become involved in a patient's care, and it can be very difficult for patients to keep everybody on track.
I know that we're working more conscientiously, I would say, on creating a seamless transition for patients. And you just described a very large team that is responsible for looking after one patient in the cancer system. Can you tell us a little bit more about some of the benefits of working in partnership with our community providers and other members of our team?
Yeah, we're working very hard to engage family practitioners in the follow-up care of our cancer patients. So patients who have a low risk of recurrence, we have defined a scenario that we'd like family doctors to follow in the follow-up of especially our breast and colorectal or colon cancer patients. So a patient who is going into the well follow-up program will be seen by a nurse navigator once they're discharged from their oncologist. The nurse navigator will then make a specific call to the patient's primary care physician to discuss what the treatment plan will be going forward, and then the patient is followed by their general practitioner. If at any time the patient needs to come back for evaluation by a specialist, that's the same person the patient comes back to. So there's just one phone call, and we can accept the patient back into the system for reevaluation very quickly.
Well, that's really interesting. So you're introducing a new role called the nurse navigator, and that seems to indicate it would be someone who can help them across their complex journey and connecting with primary care.
I've always been a huge fan of the navigator concept. I mean, patients need help working through a very complex system. Again, the system is complex not because we're trying to make it tedious for people, but because we want to bring specific specialists to the patient's needs. But always been a huge fan of making the system submit to the patient rather than vice versa. We've been able to do that with rapid diagnostic assessment programs and with the nurse navigator concept to help a patient with those transitions through the system.
Maybe just as a last word, I think some of the benefits of the new treatments for cancer care have made cancer almost a chronic condition. What does that mean for the healthcare system in terms of demand over the next 20 years?
It's going to increase. And it underscores why we're actively trying to get family practitioners back involved in the well follow-up program for these patients. But you're right, a woman diagnosed with breast cancer today has an 86% chance of being alive and well 5 years after her diagnosis. But she's going to need to have ongoing surveillance for her disease. So without having allied health people work to their maximum scope, and without engaging family practitioners in helping us look after these people, we're going to have a great strain on the system. So we're actively seeking out to our community partners to help us.
Thank you so much for joining with us today, Dr. McFadyen.
Always a pleasure, Patty.
Thank you. At Trillium Health Partners, the quality of care for our patients is our top priority each and every day. And to stay ahead of the curve, we always need to look to the future. Our population is aging. In fact, in 20 years, we're expected to have 3 times as many seniors as we have today. And as people live longer, their needs change. They need more ongoing care, closer to home, wherever possible. I recently sat down with Dr. Barbara Clive, Service Medical Director of Senior Services and Division Head of Geriatrics, to discuss the unique needs of our community seniors and how we are planning to care for them inside and beyond our hospital walls. It's my pleasure to welcome Dr. Barbara Clive to our program. Barbara is the physician lead for our seniors program and a geriatrician. But first, before we get started, Barb, can you explain to the audience what's a geriatrician?
Okay, geriatrician is a doctor, a specialist in internal medicine, which is non-surgical treatment of adult diseases, who has a subspecialty in taking care of seniors, and particularly the frail elderly.
Now, I keep hearing that our community is aging. Can you describe that a little bit more for us? What does that really mean?
Well, it means that the population over 85 is one of the fastest growing age groups in our community. And so along with that comes more old people, frail old people. And now, instead of sort of living to 60 and having one disease, many of our seniors have multiple diseases and not just one thing wrong with them.
So how has the healthcare system responded to this growing demand? Any changes that you're seeing?
Well, certainly there's an impact on Trillium Health Partners with increasing volumes and complexity of patients, but also we're changing the philosophy of care. We want to try and keep people the best they can be and help people age at home rather than looking at institutionalization or whatever. So we're trying to create different environments that people can have restorative care and work at being the best they can be. And if I can point out to you that although you think, am I going to send an old person to the gym to pump iron? Maybe not, but we do know that the very elderly actually have a greater room for improvement in their physical and functional health, often because they're so deconditioned to start with.
I know most people would like to stay at home, so it's really good news to hear that we're developing programs to allow people to age at home more gracefully and for a longer period of time. Is that what I heard you describe?
Yes, and I think that we also have a lot more support and capacity within our community to help people be at home with the support they need. So, for example, we have a program, many opportunities in our community for what are called supports for daily living. So people can stay in their own homes, and we can perhaps have a homemaker come in to assist them with their morning and evening care, prepare a light meal, or do some laundry for them to allow them to stay at home.
So Barb, how are we increasing the capacity in our community?
Well, we're developing a lot of partnerships with people outside of the hospital. So, for example, with the City of Mississauga, Parks and Recreation for our falls prevention program. We have partnerships with Supports for Daily Living, with long-term care, and all kinds of different agencies. And that increases the capacity to care for people and help them be their best outside of the hospital setting.
It is all about partnerships.
It's all about partnerships.
And so at Trillium Health Partners, for those patients who have got complex medical needs, what are the plans for the future?
Well, there certainly are a lot of plans at Trillium Health Partners for the development of the Queensway site. So we're looking at a lot more beds to provide different streams of very specialized expertise. So people who need restorative care, rehabilitation, transitional care, we will site that at the Queensway site. And also those people who have very complex medical needs that cannot be cared for in the community, we'll be looking at a home for them as well.
So it really is about creating a center of excellence for frail seniors in the future.
Yes, it certainly is.
Thank you for joining me today.
Hey, thanks for inviting me.
Welcome back to Talk Trillium, Partnering for Patients. Building the healthcare system of tomorrow requires a full community effort. The hospital is only one part of the solution. That's why we are reaching outside the hospital's walls to build and foster partnerships. I had the opportunity to sit down with Trillium Health Partners President and CEO Michelle DiEmanuele and CEO of the Mississauga Halton Lynn, Bill McLeod, to discuss the coordinated approach that's needed to care for our community in the future. Bill, first, maybe what we'd like to do is just explain a little bit more about the Mississauga-Halton LHIN. The LHIN stands for Local Health Integration Network. Can you explain to our viewers a little bit more of the work that you do to help healthcare in our community?
Sure, Patty. The short answer is that the LHINs were created by the government, so we're a Crown agency. We are the government's local representative in this geography. Now, there are 14 of us around the province, and our geography covers Mississauga, West Toronto, and most of Halton as a region. To do that, we have three real key functions. One is to fund most of the health service providers that are providing the care and services within this geography. We do planning to look at what are the future roles that each of those partners need to play, what are the developmental activities that need to take place. And then finally, in our name is integration. So we're looking at how to make the parts of the system that are operating separately work more as a system, as an entire system.
And Michelle, can you tell us a little bit more about some of the challenges you see as the president and CEO of the hospital corporation that now is responsible for the whole of Mississauga and Southeast Etobicoke? So what are those challenges?
So Patty, I think the challenges for us in the Mississauga-Halton LHIN, it really stem from history. Our particular part of our community has grown up over the last 30, 40 years in just an unprecedented way. Mississauga is the 6th largest city in this country. And with that massive growth has been really a lag in building infrastructure, particularly in healthcare. Today in our community, we're already some 200 beds short of what we need. Within the next year, we're going to be 300 beds short. And Bill and I work at looking at the next decade or more, and we know in this community that we don't have the infrastructure that we're going to need. The beds, the human resources, doctors, nurses, etc., that infrastructure to be able to deliver over the next decade or more. And so our challenges really are about growth not just in real terms, growth in our seniors population, growing almost 130% over the next decade, growth in our children's population, growing by more than 50%, also just sheer growth with new residents coming into Mississauga and West Toronto, and that unprecedented really building of this city over the last several decades.
So this community, we've got challenges with the level of growth that we have and having infrastructure keeping up with that amount of growth. Is there anything in this community that makes it unique from any other community in Ontario?
Well, I think, Patty, a clearer marker is that the number of newcomers, as Michelle's mentioned, people moving in to our community, and they're moving in from around the world, not just from across the country. And I think that gives us a whole different perspective on how healthcare is provided in the context that's appropriate to the various cultures that those folks bring when they move to this country. Canada has been founded on a huge amount of immigration over the years, and it's important that we understand that and remain very sensitive to how best to provide the services that these citizens need in a cultural, in a way that meets their cultural needs.
So on top of growth and aging, we also have a lot of diversity in our community.
Yep.
But also that younger population, Patty, that I talked about. Many other parts of our province are experiencing that aging population for sure. And some additional parts of our province experience the immigration and that cultural diversity of growth coming into their cities. But we have that added complexity, which is the baby boom that's occurring in our community as well. There are very few parts of this province that are really having to cater to a newborn population, an aging population, and immigration and cultural diversity in the way that we're experiencing.
That's excellent. Now, I've heard patients that come to our organization say repeatedly that they really want care close to home. They want to stay home, close to home when they become ill. What are some of the plans that we're creating for community capacity and in fact delivering care in the home if not close to home? So Bill, can you talk a little bit more about that plan?
Sure. So I think it's an important feature. I mean, as Michelle's mentioned, hospitals are a huge component of our healthcare system. By far the largest amount of dollars from the government support point of view go into supporting the provision of hospital care. And there's important aspects to that care closer to home as well. That, as you know, Trillium has been on the forefront of bringing greater and greater specialization, where you used to have to go to Toronto to get certain services, neurosurgery, cardiac surgery, all kinds of things, are now able to be provided within our local community. At the same time, there's that ability to take things out of a hospital that perhaps with new technologies, new drugs, new methodologies of caring for people can be provided as care closer to home or actually care in the home. And I think that's going to be a major forefront for development. I'm not sure it's going to significantly reduce the pressure on hospitals enough to say, oh, we don't have to ever worry about building another hospital bed. I think we have huge demand, growing demand, and we will need to always be vigilant about how to meet that growing demand for hospital services, but in a tempered way, in a way that says, yes, absolutely, but here's some of the things we can do in the home. And we're never going to be doing neurosurgery in somebody's house, but we can provide significant post-operative care in the home in a telemonitored way, perhaps. I mean, those are the kinds of things that we may want to become much more focused on in the future.
So it sounds like linking the hospital to the community is really important as we move forward. And I think probably primary care and linkages to primary care. Are there specific initiatives that we're doing right now that are preparing us for the future of that stronger community linkage between the walls of the hospital and our community?
Well, I think there's a few things. I think first it starts with our medical academy and the partnership we have with the University of Toronto and the University of Toronto Mississauga. You know, we are training our future family docs, and right here locally in our own community, and we believe many of those physicians will actually remain in their community living and practicing. We are working in a number of different ways with the LHIN, our Health Links program, where we're working with the hospital, primary care providers, a number of other clinical providers, nurse practitioners, navigators, to really help some of the hardest to serve stay in their home, independent, with the kind of services wrapped around them to keep them living independently in their home for as long as they can. And there's many other initiatives that we are working on with our community partners. I think our next big piece that we want to really tackle is a health hub with an urgent care center with a number of services around it to really support our patients in the community when they need it.
It's great to hear about primary care. And Bill, from your perspective, what is the strength of our primary care providers in our community? Do we have enough family physicians?
Yeah, so one of the things that we're struggling with is how to measure that. On a simply number of family physicians per population basis, we have a low number compared to other parts of the province. We also know, though, that as people age, they do require a greater focus on primary care and services from family physicians. And so we need to look at it on an age-adjusted basis. So we're working with the government to come up with a better metric to actually measure where we sit. I think the idea that we've got now a medical academy as a part of the University of Toronto very much stimulates the idea of people staying and practicing in the place where they got their medical education. So that's very beneficial to our need for more family physicians.
It sounds like a great partnership between the University of Toronto Mississauga, Trillium Health Partners, and our community to support more primary care physicians going forward.
Absolutely.
Are there other areas of partnership between the LHIN and the hospital that we're looking at towards the future?
Oh, absolutely. The whole area of our community capacity planning, I mean, the hospital is very involved in helping us understand what are the kinds of things that care that can be safely delivered at home as opposed to needing to be in a hospital bed. It is very difficult to get hospital beds built and very expensive. And so we need to find those innovative ways, and the hospital is being very much on the leadership of that innovation to help the LHIN find those pathways.
I would just say, Patty, we can't do our work without the partnership with the LHIN. They are a strong both partner and enabler for us to deliver services to our patients in the community.
Thank you both for joining us today on Talk Trillium. We have accomplished a lot over the first 3 years as Trillium Health Partners, but there's more to do. We are creating a complete system of care. It's not going to be easy, but our vision for a new kind of healthcare is achievable. We only need to stay true to our values: compassion, excellence, and courage. Courage to transform the system, unlock the potential, and seize the opportunities to meet the changing needs of our community. The journey has already started, with all of us believing in a new kind of healthcare. Believing in healthcare that works for patients and truly patient-centered design. Believing in the power of teamwork through partnerships, and believing in quality and innovation. Believing that we are better together, and that together, as a community, we can build a new kind of healthcare. To build for the future, we will need your ideas and your support. We look forward to continuing that conversation with you. Thank you for joining us on Talk Trillium, Partnering for Patients.